In the future, assistance systems should make the everyday lives of care staff easier and reduce the impact of their physical strain. They can also help people in need of care. The CareTech OWL Research Association in Bielefeld is working on human mechatronic solutions to optimize existing systems and put them into practice.
By this, we mean all technologies that have very close contact with the human body. And this close contact can be something like a wheelchair that I sit in or a bed that I lie in. And in this area, biosignals, exoskeletons, or even care beds, which we actually regard as robotic systems. We have this close physical interaction that we can hopefully improve with our devices.
To this end, the team wants to record the needs of caregivers and care recipients directly in practice.
Otherwise, we can come up with whatever devices we want, and someone would tell us afterwards, if you had asked us earlier. Nobody needs that. In other words, we no longer just do the research here on site, except the boring technology. But if we want to do something with it, then we just go to where care is provided. That can be the hospital, it can be a care facility, it can be a private context, and then try to integrate it there.
One ongoing project is looking at whether and how passive exoskeletons, which are currently available in the healthcare sector, can help.
What we want to do is look at whether they're actually assisting and offloading the load from the back. So because a lot of nurses tend to have long-term pains, so especially lower back pain. And we have an exoskeleton that we want to test with the nurses here in Bielefeld, and we're gonna see its performance by measuring EMG signals, so the signals from the muscles, and kinematic data in order to determine the onset of fatigue. So if it delays that onset of fatigue, that means it's actually offloading some of the weight from the human body to the exo.
In addition to EMG measurements for passive exoskeletons, the focus is on recording muscle signals for controlling active orthoses. These should, for example, be able to support arm movements with electric motors. In this way, they could also relieve nurses in their lifting work or people in rehabilitation. The team uses an exceptionally large number of electrodes in its research to obtain particularly comprehensive information and avoid possible measurement inaccuracies.
This means that I don't move my arm first and then a sensor reacts and measures what happens, but the electrical signals come from the brain to the muscle. And if we then measure them before the muscle or measure them on the muscle, we still have a certain amount of time to control the orthosis.
The signals could therefore intuitively predict movements.
We probably need the intuitive aspect in this area because we want to support nursing staff, for example. They don't want to attend a seminar for such an orthosis. And you can also think about supporting older people, for example, with 10% of their muscle strength, so they can simply stay more mobile. I don't think about moving my arm, and I don't want to think about the prosthesis moving my arm either.
Another project is the care bed, which uses AI to predict pressure points in patients. Instead of a direct and cost-intensive measurement using pressure sensors in a mattress, several types of cameras are used: thermal imaging, RGB, and depth imaging.
So my goal is to make an AI model which will train based on the depth data, RGB data, and the IR sensor. And we're going to take the ground truth as the pressure profiles, which is measured by the pressure meds. So using those data, we're going to train the AI model. Then afterwards, we're going to remove this pressure med, and AI model will be predicting the pressure profile of the patient, which is lying on the care bed in the real time.
This method of pressure ulcer prediction could in turn support care staff by allowing the care bed to react automatically to possible bed sores and prevent them by making slight automatic movements as an independent robotic system.
So let's say our AI predicts accurate pressure profile, and using that pressure profile, we can assist the patient maybe with a human assistant if there is a nurse or doctor around he can adjust the posture of the patient and relieve from the discomfort. Or we can do robotic application. So in that case, we have a care bed which has multiple drives in it, and using those care bed as a robot, we can adjust the patient's posture by tilting some bed or maybe adjusting the patient's posture.
The projects of the CareTech OWL network are still at an early stage. However, the practical approach should mean that helpful results will not be long in coming.